I've been doing stem cell harvesting and implant isolation and implantation now since 2012. I was one of the first in the US doing adipose-derived stem cell procedures. We work with Cell Surgical Network and use something called the time machine that helps us to, within an hour's time, be able to isolate the stem cells from the adipose tissue with a pretty simple process. We also send some of that fat or adipose tissue to American Cell Technology in Florida for stem cell banking so that they can be retrieved, culture expanded, and utilized later, many years later. I banked my stem cells in 2012. I use them almost every year for a number of different things. And when they've been banked, the cost is 70 to 80% less to use your stem cells than the initial procedure. So it still can be cost effective initially when you compare it to the cost of surgery and therapy and all the other things that need to be done or may need to be done. But when we can use your bank cells and we order them a couple of weeks ahead of time, they're shipped, delivered to the office, we use them same day, whether it's a joint injection, whether we do scalp injection for hair growth or facial rejuvenation. There's many applications, but I'm really excited about the results that I've seen for the last 13 years, and in thousands of injections. And again, across the board, the numbers are about the same, 80 to 90% reduction in pain. I have many that have no pain. And over 90% of the time, it's one injection. Well, stem cell therapy really benefits everyone, and the younger you are, the better, because you have more stem cells. The reason I prefer adipose over bone marrow, and there are plenty of people that I know that do bone marrow derived stem cell treatments, is they're younger. The cells in adipose do not turn over as fast as those in bone marrow. And so I see patients that have had injuries in their teens, 20s, and now in the 30s, it's starting to ache and hurt. And certainly by 40, you have degenerative arthritis. So do you really want a joint replacement? Because in 15 years, you're going to have another one. Well, that's not very high on my list. And so, I've had both of my knees injected and have had zero pain since I did it in 2012. And so that's 13 years ago. I still have no knee pain. I had pretty significant what's called chondromalacia of the patella from an old ski racing accident in college. But so I don't know that I can share an average age. Sure, I see plenty of people in their 50s and 60s that have arthritis, that are tired of taking pain pills and ibuprofen and anti-inflammatories. Nothing's really working. They're scared of having a joint replacement at that age, because if they're 50, they're going to be around a while, and that knee's probably going to get revised at some point. And so why not use your own cells, and why not bank them for future use, so when you need them for many other things, that they're significantly less expensive. And so to me, it makes sense. And I think the future is pretty bright for applying stem cell therapy, not only to injuries, but to many things that we encounter as we age. So the procedure is very simple. It's a minimally invasive liposuction done under local anesthetic. And most people are willing to volunteer and donate a little fat. We actually only need as much as a couple of ounces, and so we'll often take a little more than that. We'll send off a shot glass, 15 to 30 cc's of fat to be processed at the cell banking facility, and then process the rest in the office in over about an hour, as I said, to then have the stem cell isolate to be able to inject and utilize in whatever method we choose, whether it's knee, hip, shoulder injection, etc. As far as scarring, this procedure is done, and when we access a little port through about a 1/4 inch incision on each side of, let's say, the abdomen or the lower back, sometimes just depends on, where the best supply of fatty tissue is. And so it heals very quickly. We either leave it open with a dressing on it, and it almost heals overnight within a day or two. Sometimes use a little steri-strip, but we don't even, use sutures on it. It's literally a 1/4 inch incision. The entire procedure time in the office is about 3 hours from the time someone starts, gets here, we get things set up. It takes me 15 to 30 minutes to harvest the fat, and then they're going to rest. We usually go to the IV room, either give them a vitamin cocktail on the house or sit them in front of the red light therapy to relax. And we'll process those cells in an hour and then be ready to do the injections. So 3 hours maximum from the time they walk in to the time they say goodbye.